Hi everyone, my name is Abdullah. Today I'll be presenting our research topic, which is prevalence of peripheral arterial disease among adults of ages 40 and above in the United Arab Emirates. So our group members are Lina Sayyid Taha, Sarah Sayyid Taha, Sana Fatima and me, and our supervisor is Dr. Shada Sharbati. So this is our content today. So I'll start with brief introduction on PAD. So PAD is defined as atherosclerotic occlusive disease in the arteries of upper and lower extremities. Most commonly, it affects the arteries of the lower extremity, resulting in pain and discomfort after rest. So it has been associated with increased risk of lower limb amputation and atherothrombosis. Risk factors of PAD include tobacco use, obesity, hypertension, hypercholesterolemia, diabetes, and age and gender. So despite the high prevalence of risk factors associated with PED in our region, there is few data regarding the prevalence of PED in the United Arab Emirates. So we decided to do this study to show the extent of the disease and to stress on the magnitude of the problem. So our objectives in our study is to assess the prevalence of PAD in patients ages 40 and above in the UAE, to assess the prevalence of risk factors including smoking, diabetes, hypercholesterolemia, hypertension in patients with PAD, and to find association between PAD and other factors such as age, gender, and ethnicity. So in this cross-sectional study, we targeted patients who attended Thombay University Hospital in Ajman between 2020 and 2021. We included all patients ages 40 or above who agreed to participate by signing a consent form. A total of 204 participants were included in this study. All patients were given a questionnaire that was developed by our team. Within our questionnaire, a modified Edinburgh claudication questionnaire was added, which is a standardized questionnaire for intermittent claudication to meet our objectives. In addition, after answering the questionnaire, we calculated the ABI of each patient and it was performed according to the standard guidelines. So the study was approved by GMU IRB. Participants were enrolled after explaining the objectives to them and getting their signed informed consent. Patients were also informed of their right to refuse the participation. We followed the ABI standard guidelines and the examination was done in the privacy of a separate room in a clinical setting. We assured the participants that the study was anonymous. The information provided will be analyzed by the group only and there will be no link between the person and the result. Data was entered in an Excel sheet and IBM SPSS version 27 was used to analyze the data. So out of 204 participants, the majority of our participants were between 40 and 50 years of age, and majority of them were male, Asians, and they were married. Majority of participants followed the Mediterranean diet, and they exercised less than 3 days per week. Majority of them were non-smokers and overweight. So this is a self-reported multiple response chart showing the medical history of participants. Among participants, the highest chronic disease was hypertension with 36%, followed by hypercholesterolemia with 30.5% and diabetes with 19.2%. This is also a multiple response chart and the chart of the family history of the participants. The chart revealed that 58.6% of them have family history of hypertension, followed by diabetes with 50.7% and hypercholesterolemia with 29.6%. So this is a summary of our research finding where it shows that based on our research, the prevalence of PAD was 22.7% among participants. So this table shows the association between the socio-demographic details of participants and PAD. So in this study, there was significant association between PAD and age. The results showed that age group above 60 years and old have the highest frequency of PAD with 45.5% among the studied population. PAD increases with age, which is why our results showed that those in younger age groups had the lowest frequency. In this study, there was also a significant association between gender and PAD. The prevalence of PAD was higher among females compared to males. These findings disagree with most of the literature studies. This can be attributed to the older age and other associated risk factors among the studied females that cannot be excluded. So This table shows the association between PAD and chronic diseases like hypertension, hypercholesterolemia, and diabetes. There was significant association between PAD and hypertension. Our results showed that those with hypertension had higher prevalence of PAD compared to those without hypertension. The mechanism of hypertension causing PAD results from endothelial dysfunction, platelet activation, and increasing oxidative stress. All these factors contribute to atherosclerosis and PAD. Our results also showed a significant association between PAD and hypercholesterolemia, and also significant association between PAD and diabetes. So this table shows the association between lifestyle and habits with PAD. So our results showed that even though smoking is an important risk factor, yet no significant association was found between smoking and PAD. However, it should be noted that we found that the prevalence of PAD was slightly higher among smokers compared to non-smokers. The current data showed a significant association between duration of smoking and PAD. Participants who have higher duration of smoking, more than 25 years, were at higher risk compared to those who smoked for a lesser duration. So this table shows the association between PAD and various symptoms that are usually seen in intermittent claudication. So results showed that there is significant association between pain and PAD. According to this table, patients with PAD are more likely to have pain in their lower extremities that lasts less than 10 minutes, and it's associated with feeling of coldness in their lower limbs. Okay, so in this chart, looking at the crowd-odd ratio, so you can see that individuals within the age range 51 to 60 are 2.4 times more likely to develop PAD, while individuals older than 60 are 3.4 times more likely to develop PAD. Coming to the gender, data shows that development of PAD is equally likely to occur in both genders. In smoking duration, individuals that have smoked more than 25 years are 8.6 times more likely to develop PAD. For hypertension, hypertensive patients are 2.2 times more likely to develop PAD, and patients with hypercholesterolemia are 2.6 times more likely to develop PAD. For diabetic patients, it's 3.1 times more likely to develop PAD. So in the adjusted ratio, the data shows that individuals with hypertension are 29 times more likely to develop PAD, and individuals with diabetes are 8.6 times more likely to develop PAD. So this study was performed in a hospital setting, and almost all participants were patients with underlying chronic disease. Thus, the prevalence could not be generalized on the population of the UAE. So this was the major limitation of our study. So in this study, we concluded that the prevalence of PAD in people ages 40 or above in the UAE was approximately 23%. There is statistically significant association between PAD and age and gender, but no significant association with ethnicity. We found a significant association between PAD, hypertension, diabetes, and hypercholesterolemia. There was significant association between the duration of smoking, BMI, and PAD. Finally, we recommend to utilize ankle brachial index in routine clinical examination by healthcare providers as a screening tool for patients with high risk, and to educate UAE citizens on the risk factors and symptoms of PAD. So these are our references that we used for today's presentation. Thank you.